A lot of people are wanting to hear this. Cataract surgery is the most frequently performed outpatient surgery in the U.S. Up until just recently, it was always performed using a blade and a needle. Well, now local ophthalmologist David Bernitsky is offering blade-free technology for this type of surgery. Here with why this is so beneficial for patients is Dr. Bernitsky. I want to thank you so much for joining us this morning.
Thanks for having me.
So let's get right into it. You know, cataract surgery, a lot of people go through this, especially as they get older. So, you know, why turn to a different type of surgery like lasers? That's what we're talking about, right?
Yeah, exactly. It's just a way to make a procedure that's already very good, safer, and more predictable.
Okay, so what does it exactly do as far as lasers?
Well, it takes the place of a blade. We use a scalpel to make the incision into the eye to be able to remove the cataract, which is a cloudy lens inside the eye. And what it does is create that using laser light and very teeny bubbles instead of the blade. And then it also allows us to make openings in the front of the cataract so that we can get it out of there in a way that we used to just do with a needle. We used to tear it around by hand, kind of a circular hole. And then it also divides the lens so that we can take it out using ultrasound power.
Okay, and we were talking during the break. You said with lasers, it's more precise.
Yes.
I guess you really can fine tune where you're cutting.
Yeah, the location, the depth, the length of the incision are all pre-programmed, and they always come out exactly at that length.
Okay, you know, a lot of people are probably wondering, are they candidates for this type of surgery? Not only just cataract surgery, but cataract surgery with lasers. Are they candidates?
Pretty much anybody who's a candidate for cataract surgery would also be a candidate for laser-assisted cataract surgery.
Okay. Recovery time, is it any different? Is it about the same?
Pretty similar, actually.
Pretty similar. It's just new technology that is really useful for you and to make sure that this your surgery goes well, right?
Yes.
Okay. So tell me about cataract surgery just in general. When does somebody know that they do have cataracts?
Well, typically they'll notice changes with their vision. Most commonly driving at night, driving into headlights, high glare setting, just difficulty with kind of haziness to their vision.
So when they start noticing this routinely, they should contact their local doctor, their local eye doctor, right?
Absolutely.
And get checked out. If you don't get it checked out, what could be the consequences?
Well, the nice thing about cataracts is that they'll be successful having them removed regardless when you do it. It's just you're not going to see well in the interim.
Okay.
And so you could get in a traffic accident or have some other problem.
Okay.
So.
If somebody is experiencing this at home and they're concerned about having surgery, could you kind of ease their fears a little bit? You know, what can they expect when they go into the operating room? What can they expect when they leave?
Sure. Well, it's really become a remarkably simple process from the patient standpoint. It's an outpatient surgery. The procedure itself only takes 10 or 15 minutes. It's done with a topical anesthetic. We just get the eye numb with drops. You go right home and go immediately back to your full activities. It's kind of a non-event anymore.
Oh, wow.
Yeah.
So it's really simple.
Very simple.
You know, I know people just think surgery. When they hear the word surgery, they get a little terrified. I know I would. So they shouldn't be afraid to contact their local doctor to talk about this.
Not at all.
How can they get more information about just cataracts in general and the new surgery?
Well, they can contact us at our office at 323-0800.
Okay.
Or visit us on the web at bernitsky.com.
Would you say you guys are pretty booked? Do a lot of people, you know, suffer from cataracts?
Oh, yeah. It's by far the most commonly performed surgery in America every year.
Okay, so they should contact you as soon as possible.
Sure.
If they're noticing some type of, you know, difference in their vision.
Yes.
Okay. All right. You know, and again, your phone number one more time.
323-0800.
I want to thank you so much for joining us.
Thank you for having me.
You bet. We'll be right back. Stay there.